Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hip. It is Ober test. So this test was developed by Dr. Frank Ober, and there's a little bit of a discrepancy in when exactly was the first publication describing this test. Most people will say it was in 1936. However, there was a paper that he did speak about this maneuver in 1935, and I will talk about just a little thing that came about that in just a moment. But he developed this test because he was saying that individuals who have low back pain or sciatic pain and they don't have any abnormalities in their lumbar spine, that it's coming from a tight IT band or a tight TFL. And what that is doing is that it's just causing an abnormal tension on the pelvis, which is leading to an altered posture and the mechanical strain, and then it causes these symptoms radiating into the leg. And so he was a proponent for performing releases of the IT band and the TFL, because he had patients that he had performed that on and they felt better. So he said, okay, well, that this is kind of possibly a cause of it. So that's the little discrepancy like I talked about earlier, because he had put out that paper in 1935. Well, there is evidence of a letter to an editor in 1935, which kind of talks against that maneuver and what he had said in 1935 earlier that year, because he said there's some misconceptions in the anatomy, and they wanted to prevent an epidemic of dangerous operations on that hip structure, because he was kind of pushing for that. So kind of interesting in it. But anyway, let's get in on how to do it. To perform this test, you have the person lying on their side. If you're going to test the affected side, they are laying on the non-affected side, so the non-painful side. The painful side is up, and then of course the reverse for testing the other one. But what you have them do, you flex that other knee in the hip, so that gets that leg out of the way there. Then make sure that they're all the way on their side there. And what you're going to do, now in the original paper, they had the knee at 90 degrees here, but you can test it at 90 degrees and sometimes with the leg straight as well. So you can actually do both of them. I was taught both of them to kind of bias the TFL versus the IT band. But they're here, so what do they like the original way? Support under the knee, so you got their leg. Support the pelvis. You want to stabilize the pelvis. We don't want that moving. You bring it up into abduction, a little bit of extension, and then you lower the leg, lower that knee down. And a positive for this is that the knee will hang in the air. And a negative is that it will break that horizontal plane. So that's how you do Ober's test. So getting in on the research for this test, there isn't anything on like the sensitivity, specificity, or validity of this test. However, there is some stuff on the reliability. So it has been shown to be a reliable test. So remember, reliable means it's going to hit the target every single time. So it will test what it's supposed to test. And so there was a paper in which researchers looked at 300 recreational athletes, so 600 total legs that they looked at, and they found that they had a 97.6% agreement. So they were performing this test to see what kind of mobility, flexibility, or all that with these people, and they found a super high agreement rate with doing this. So yes, this test is reliable. So it's going to be the same for, possibly the same for me as for you, and for you, and for me, and other, Joe over here and Jane over there. Anyway, but here's the thing, that they did another article in an experiment to see, does this test actually stress the IT band and the TFL? Because that's the whole thing. That's what we learned about it. That's what you test the IT band for. You do Ober's test. And so in this article, these researchers took cadaver extremities and they performed Ober's test on it, measured it, And then what they did was that they started releasing the IT band. So they just performed some cuts and started releasing it, and found that when they started releasing the IT band, it did not significantly change hip adduction. So it didn't actually start improving. Now, they didn't stop at that. They said, well, you know what? Let's look at releasing the glute minimus and the glute medius, and let's see what happens. And guess what? When they started doing that, they started gaining hip adduction. So when they released the min and the med, the hip started adducting more with this test. They said, you know what? Let's do a little bit more. So they said, let's look at releasing the hip capsule, and they gained even more hip adduction. So they speculated that this test may not actually be as much about that stiffness and the tightness in the IT and the TFL, but maybe more into the glute min and med and hip capsule tightness. Now, they also said, you know, these were cadavers. This wasn't living tissue. With a living person, you may have more involvement of the neuromuscular control going on in it. But it's kind of interesting that they looked at that. But anyway, that is Ober's test. So again, you probably learned about it in school. I like learning about this to see who the people were. But anyway, let us know, do you use this test? Do you like this test? Do you find it's like, hey, it's a pretty interesting thing to do. I have it in my hip evaluation or my back. Anyway, let us know. Of course, if you like the video, please hit the like button down there. It helps out Mateo. Makes Mateo happy when you do that. But anyway, and as Mateo also always says, take care of yourself. Take care of your patients. We'll see you next time.